As I mentioned, my name is Bryan Boam from Network Consulting Services, and joining me today is Terry Ray, the Chief Product Strategist for Imperva. For those of you that are not familiar with Imperva, Imperva is the market leader in web application firewalls and database protection. In fact, if you research Imperva, you'll find that Imperva holds the extremely rare position of being the only web application firewall company in the upper right-hand quadrant of the Gartner Magic Quadrant for web application firewalls, and has held that singular position for 2 straight years. That's a little rare in the industry to see that companies alone in that quadrant, let alone to have that position for 2 years. In addition, you'll also find that Imperva is market leader in database access monitoring and blocking suspicious user behavior. This is incredibly important in the healthcare world, as there's a wildly disproportionate number of database breaches in the healthcare organizations with relation to other market spaces. In fact, some of the largest healthcare providers and healthcare software companies use Imperva to protect their assets. There's a good chance that the software company that wrote the software that many of you are using to run your hospitals and organizations is using Imperva right now. So today's presentation will cover how to monitor database activity in heterogeneous environments, as well as, or in addition, we'll cover how it relates to HIPAA, PCI, and SOX compliance. And finally, how you can protect your data from insider threats using Imperva tools. It's my pleasure this time to introduce Terry Ray, the Chief Product Strategist for Imperva, and he will handle the majority of the presentation. I will be monitoring it for the questions and interrupt as necessary. So Terry, take it away.
Great, thank you very much. Welcome everybody. So I'm going to just jump right into this. I will tell you a little bit about my role here in Imperva, why maybe I'm qualified maybe to chat with all of you today. So I have been at Imperva for 13 years, doing pure data security for 13 years. And I was the first engineer at Imperva here in the U.S. So I have helped deploy and utilize technology to solve these types of problems really thousands of times over the last 13 years. So point is you know, we're going to dig a little bit into this, but we'll be talking a lot about the threats that we see out there, as well as the solutions that kind of go along with them, and some of the things that organizations like yourselves or others in some cases do today to try and solve the problems, but maybe perform a little bit too much of a manual effort to really get things done where they'd really like it to be. So let's move on to the next slide. Let's see here, get all this organized. Now this slide is going to build a little bit here, so you'll see it kind of populate. The source of this information is a website called Information is Beautiful, and effectively what they do is they take all the breaches that happen, as you can see, year over year over year. Any breach that was greater than 50,000 records, they put it up on here and make it nice and pretty. And the result that you should get from this is really that when we look at these types of breaches, there's not less breaches, there are in fact more breaches. And not only more breaches, the breaches are getting larger and larger, looking at the large blue circles there, right? So really indicative of what's happening in the industry as a whole. We start to look at, as we spend more money in security, as we develop more security tools and bring more tools into an organization, are they really solving the problem? Or are we really maybe not putting the tools in the right place? And so we'll ask some questions as we go through this about where do we have visibility, where don't we have visibility, and where does security come to play? We start to talk about the difference between what security has as a role within data security and maybe what other organizations have as a role within data security, IT risk, database security, or database administration, etc. And let's take a look at this in a little bit different way if we look at a different slide here. The source of this is Privacy Rights Clearinghouse, and I don't update this all the time, so this is only through October 2015 for the year of 2015. So a good 3 quarters, if you will. And I've highlighted in dark orange all of those that are healthcare related. The yellow ones are the ones that maybe we should just all kind of care about, because I use Uber all the time and fly United all the time. You saw United got hit twice last year. But we see all the orange, and the orange is critical primarily because it's all healthcare. And really when we start to summarize everything, in terms of an industry, healthcare was the largest hit industry from a data theft perspective last year, far and above any other individual industry. I think a lot of people have a lot of different theories, if you will, on why that was necessarily the case. But what we saw being stolen from a lot of these organizations in many cases was actually not data that was regulated. And I think that was the big kicker for me when I started looking at Anthem, who you see on here, Primera and Excelis and some of the others that are on here. You know, we started to see their data starting to get taken out. It was not typically the data that was would fall under the HIPAA regulation, certainly not PCI or Sarbanes-Oxley. So what did these organizations do, and why wasn't that data protected? These are questions we'll answer as we kind of go through this. So if we look at a little bit of a dated report, this is about 2 years ago from the Verizon Data Breach Report. But really what it talks about are the areas where people have compromised or organizations have compromised debts. Now you can see the ones I have highlighted, but there are a lot of others in there: point-of-sale servers, automated teller machines, mail servers, payment card systems, etc. But when we start to look at the ones that have the highest percentage of records that are stolen from them, you really have to look at the web application servers and the databases. This is where we play. Yes, desktops and workstations have, in terms of percentage of records, about 34%, 36% of records when they're stolen are stolen from them. File servers far, far less. But when we see data that gets stolen from a percentage of breaches, the amount of data that gets stolen from them is a significantly larger amount of data than what you would see anywhere else in terms of the locations where data can be accessed within an organization. And so I ask organizations to start thinking to themselves, how much scrutiny does an organization have around desktops and workstations, antivirus, anti-malware, who knows whatever else? What about the network? You can see network's not even on the list in terms of where data gets stolen from necessarily. Obviously it has to go over the network, but we're talking about network resources. When we talk about data, data gets stolen from a couple of places. Typically it's through a web server, and very commonly it's from a database, less commonly from a file server. So then as an organization, the question I ask organizations is, how well do you know who's touching your data, how they're touching, where that data is? And obviously no one can answer the question here, but the common question I ask is, do you know where your sensitive data is? And is that a definitive, yes, absolutely I know where it is, or yeah, I kind of think I know where it is, but I'm not exactly sure. And that starts to raise the question about what level of visibility we really have when we look at what type of data exists out there and how much security we have on it. When we go to the next slide, we're really looking at, again, another way to look at the Privacy Rights Clearinghouse data. And when I looked at this, you see over the last 5 years or so, we've seen varying amounts of records being stolen per incident. But then we also see the total incidents. It looks great. Total incidents are down. At least in 2013, 2014, 2015, there are fewer overall incidents throughout the year. The problem is, as you can see, the green line, the number of records being stolen are much higher than what they've ever been. 2011 was a bit high, but beyond that, it's been much, much lower than where it is at this point. You ask yourself why? Well, in a lot of cases, what people are targeting, or what threat actors, if you will, are targeting, is they're targeting data repository stores, and they'll steal absolutely anything they can. And in many cases, this isn't something like credit cards where you have one credit card per one user. It's stuff like you see stolen from some of the healthcare organizations where it's one record, but within that record, I've got the entire family piece of information, all their phone numbers and children's names and mother's names and father's names and everything else that goes in there. That's a lot of data that gets pulled out that can have some very interesting things done with it over time. Now, Home Depot, interestingly, I just got an email yesterday talking about the settlement that Home Depot made. Up until yesterday, they had already expected the attack to cost about $236 million, and just yesterday they settled finally for about 161, I think the number was, $161 million for some of the class action lawsuits and some of the other things that were being done. Point is I still shop at Home Depot. Everybody else still shops at Home Depot for the most part. This didn't really impact their overall business. It impacted their stock price, and their profits fell shortly. But they've rebounded since then. The cost to them, quite frankly, was a 3 or 4 year litigation cost and 3 or 4 year incident cost per user that wanted to set up some level of identity theft protection. But that's a short-term piece for them. They'll pay it and it's done. But it's not inconsequential. It's going to wind up costing them a little over $300 million to lose 40 million records. Well, I mean, you can look at the numbers for Anthem. Anthem lost 80 million records. It's a lot to lose, and it's obviously a large expenditure there. So we'll talk more about it as we go forward. So when we start to talk about how things get stolen, obviously we're going to talk about the database here when we talk about HIPAA, PCI, Sarbanes-Oxley, and otherwise. Some of those have relevance in the web application side as well. I personally think they all do, but when we look at the database and we look at data and data being stolen, it really, I think it behooves us to start where the data lives, in the database. It's where we typically have the least amount of scrutiny, the least amount of visibility, and the least amount of control, unfortunately, in most organizations that we talk to. And there are typically, if you kind of bundle them all together, typically 3 different people that impact those environments. The compromised user, your malware folks, those sorts of things. The careless user that just doesn't know any better. And the malicious user who just doing something they really shouldn't be doing anyway. Now, there are drivers behind having solutions or auditing or having security around your database. Obviously, the primary drivers for the last, I would say, 2000 to 2010 has been regulatory compliance. That was the primary driver. We started having a product in 2002 that was all about database security. And I will tell you, it was very, very difficult to have a conversation with a CISO in 2002, 2003, and frankly all the way to 2010, 2011 with a CISO that had a mandate to secure data. It's only in the last 3 or 4 years have we seen the CISOs, the security organizations, come to play that say now the board is saying, how do we not be Primera? How do we not be Axelis? How do we not be some of these other organizations that have lost data? What are we doing to make sure we're not those people? And now the security people are coming to us and saying, what can you do for me? But prior to then, we were talking to DBAs. We were talking to IT risk, and they were saying, we have to meet HIPAA, SOX, PCI, whatever you see here on this page, right? So it didn't really matter as long as it had to do with data. How do you help us do this? Because we're unable to do it today because we can't turn on the native tools that exist with our database, or it's just too manual of an effort. Or quite frankly, we don't even know where the data exists. So what do we turn on and what do we look at? We can't look at everything. So there were a number of issues that came to play, and really the result was a lot of organizations just didn't have the appropriate data when it was necessary. So it really begs the question about what people must do versus what people should do. And obviously what you must do is you must meet regulation, or else you face the penalty of fines. You know for a fact you're going to be audited. There's no question. You will be audited. So you know you have to do the regulatory compliance, if that's HIPAA, Sarbanes-Oxley, whatever it happens to be. However, where they converge is in security. Now, security is going to say, okay, fine, you're auditing PCI, HIPAA, NERC, ISO. Are you securing any of it? Now, again, it's a rhetorical question, but it's a question I ask all the time. When you start to talk about securing your data, how many organizations really think about, I'm going to block access to people or organizations or applications touching my database? What's interesting to us is we see on the website, as was noted earlier, we see on the website that many of our customers that use our web application firewall block. They block because it's a security solution. They know they need to block. It's an enforcement scenario. When we look at the database side, though, even though the database just feeds the application, there's really just another step in the chain, if you will. On the database side, traditionally, I saw very, very few people interested in blocking. And I felt like the difference between these two locations of where data can be accessed is on the website, the security of the website has always been the purview of security departments. And security departments, by virtue of what they do, tend to block. The database realm has always been the purview of typically IT administration or DBAs. And there's nothing wrong with DBAs, by the way, but it's always been their purview. And their mandate has always been reliability, functionality, uptime. It needs to always be there, otherwise it can impact the business. And so blocking has always been something that is not something that organizations would be interested in doing on the database side. Now we're starting to see that change. Take the scenario of a large-scale breach, and I'll stop picking on particular companies, but a large-scale breach, you lose a lot of records. When you lose a lot of records, the CISO gets a call at night, the security VP gets a call at night, says, okay, we appear to have lost 40 million records. We need to start figuring out what's going on. If there were security in place that were sitting between the users in the database, and that security could have easily have simply said, look, as a DBA, on everyday business, all you need to do is access 5,000 records. I'll give you 5,000 records if that'll let you do your job day to day. And on the one outlier day every once in a while you need to look at 20 million records or 40 million records, whatever it is, then we're just going to ask you for a checks and balance. We just want a second factor here of some level of authorization before you go and access 40 million records. Would that be acceptable to the DBAs? And in these types of conversations, it is, right? But it's about having that conversation between the security department that needs controls and the DBAs that need uptime, reliability, and functionality, and working together to make sure that the appropriate policies can be put in place. So when that CISO gets that call at night, it's not 40 million records that are gone, and as bad as it may be 5,000 records. And while there are solutions that would even prevent the 5,000 records, The reality is at least some level of control can be there. And that's where we tend to be with most organizations today, is that kind of tiptoeing into security. And that's what our mission really is here, is trying to move companies from what they must do toward what they should do. And this is a big part of the problem when we see it. If you look at some of these organizations who have lost data, a lot of these organizations lose data because the data that they lost was in the security side, or I'd say in the blue side on this particular slide, in the data section. Oftentimes, this data is not regulated in a particular type of governance, so it falls outside of what you must do, but it really should be someplace where you should do. And in many organizations, they prioritize what they're going to look at from an audit perspective or security perspective. I hear it multiple times every single day, or when I talk to anyone, CISOs or DBAs, they say, we're going to start with our PCI data. We know we have to do that. We've got to put controls around it. And again, a rhetorical question, but how often do organizations get to phase 2, really being able to put controls around all the data that is not regulated? And in my opinion, that's where organizations really have to start looking, because that is where the breaches are happening. It's not whether the data is important to the organization, it's whether that data is important to anyone else who might steal it. And all of the things you see down there under the data portion, many of them, again, not regulated, some under some certain circumstances are, but all of that's very valuable to people on the black market, and it's all stuff that you can't just change. I can change my credit card number in a heartbeat. It's hard to change my name, my address, intellectual property. Once it's out, it's done. So this is where, part of the conversation we talk about is, how do you simplify the process of solving the problem of moving from phase 1, the priority items, to phase 2, to phase 3, and really being able to have a true data security program in an organization like healthcare. So I'm going to build this slide out here a bit. When I look at the frequency and unknowns, this is another way to look at the data, and then we'll be getting shortly out of the, call it the threat landscape, if you will. The frequency unknowns. When we look at this type of data, again, this is kind of the same scenario. This was September through October of 2015, and then a little bit before then, earlier last year, February through May. And the key here isn't to look at the numbers. The numbers really aren't so important here. What is important, and many of you may be thinking this, is why all the unknowns? When we look at this data, this is Privacy Rights Clearinghouse here. Why didn't Toys R Us know what was taken? Why didn't Piedmont Advantage Credit Union, as small as that probably is, why didn't they know what was taken? Bistro Burger, Apple America Group, LLC. I don't think that's related to Apple as you might know them. Right, so the key here is really being able to understand that most organizations don't have the visibility to be able to actually say, I know what was taken. And if you look at some of these breaches that happen, even here, look at Experian, 15 million records. Now, do we believe that exactly 15 million records were stolen, or do we believe that that was a ballpark, if you will, in terms of what was taken? Do we believe that Scottrade lost 4.6 million records, or exactly, or some other number that's relevant here? Right, so we get some exact numbers on the right side, 941, University of Maine, 11,266 at Microsoft. Okay, I can believe those. But the point here is most organizations do not have the visibility to answer a simple question. Who touched my data, and what did they touch? What did they take? It's a simple question, but it's one that most organizations, healthcare or otherwise, simply cannot answer. So why can't they answer them? And what are the solutions that organizations do today? There are 3 options when we start to looking at data. There's just simply don't do it. Don't look at your data. Do not audit. Utilize those native audit capabilities that exist within your database already, MS SQL, Oracle, Sybase, DB2, Big Data, Teradata, whatever it happens to be. They all come with tools that allow you to turn on auditing of their databases. And you can certainly use those. And then, of course, implement a dedicated database auditing solution like what we offer. Now, obviously, there are advantages and disadvantages to each, and we'll talk a little bit about them. And it might be no surprise to most people, but most solutions, most organizations wind up choosing the top item, which is do not audit, unfortunately. And we'll talk about why. So when we look at the challenges, consider an organization, a large organization, a very large organization. They're not going to have one of these databases or one of these database environments. They're going to have 2 of them, 3 of them, 10 of them, 15 of them. And when you start to get beyond 1, 2, or 3, you're talking about 1, 2, or 3 database groups. Most DBAs don't know Oracle and MS SQL and Teradata. Most DBAs don't know Mongo or Sybase and mainframe. These are completely disparate groups, completely disparate products, and the ability for them to audit themselves with the tools that exist there are completely different as well. Some of them will give you what you need for audit. Some of them simply won't. None of them have the ability to tell you where their actual classified data exists, so they don't help you get there anyway. But the point here really is, how do you go about solving a problem where you have an environment where you have lots of different kinds of databases? That's one problem. That's not the only problem. Let's look at some of the problems of why organizations choose to do nothing, simply don't audit anything of value at least, over doing the native tools that are there. For those of you who are on the phone that are DBAs, you know that when somebody asks you to turn on native audit, one of the first questions you ask is, how much do I need to turn on because I know this is going to impact my database? How long do I need to have this on, and to what degree, what detail of information do you need to have? Because again, the more detail, the more it's going to impact my database. For those of you in security or IT risk, you know that when you have asked a database team to turn on these types of solutions on their systems, these are the things they've asked back. What do you need to see? How much do you need? Because I can't give you a ton because it's going to impact my uptime, my reliability, and more importantly, my response time from the database. So what are we going to talk about here when we start to talk about the disconnect between security organizations, what risk needs to have, and what DBAs can effectively provide with the tools that reside on the database itself? So these are the types of issues that they come about, and this is why organizations oftentimes will say, I don't have a solution. I either can choose native audit, which is going to impact my response time, which is going to impact my business, and that's problematic, or I can choose to do nothing, which is going to obviously not impact my business, but often obviously opens me up to risk in terms of both governance as well as data theft. So organizations make their choices. Unfortunately, a lot of organizations choose to prioritize their data, which is maybe all they can do. I'm going to prioritize auditing HIPAA, PCI, and Sarbanes-Oxley, and everything else falls to the wayside. We just don't have the cycles to do it. And that's exactly what we see happening in these types of large breaches, where it's not typically regulated data that's stolen, it's everything else because it just simply isn't being monitored or secured. So let's talk about really what should be done here. When we start to look at what should be done, you need to answer some simple questions, right? Exactly who is accessing my data? Where is my data? And that's not on the list here, obviously, but where is my data? And is the data that's being accessed, is it appropriate? Should this data be accessed in the way it's being accessed? Should it not be accessed that way? What type of analytics or intelligence do I have to read the data that I'm capturing and do something with it? Is it enough to just have an audit log and read it when something happens and have my forensic and incident response team say, okay, yeah, we see what happened here, that's great. To be fair, that would be better than what we have today, but is that enough from a proactive security stance to be able to say, Terry logged into my database and then accessed 40 million records, and he's never done that before, and neither have any of his peers, and neither has anybody else in the company, yet here he just did it. That's something I'd like to know about right when it happens, and maybe even be able to take actionable action on it and say, this isn't going to happen. This violates policies that I have. This is too unusual for me. So this is where we start to talk about the alternative to no audit, the alternative to native audit, which already exists, which tends to be manual, of course, and obviously impactful. We start talking about database audit and protection, or database audit, database audit and protection, or database activity monitoring. You might have heard either of these two terms. Really what this is off database audit and protection. It gives organizations the ability to provide all the things you see here on the screen, but more importantly, the ability to secure data without requiring you to turn on the native audit logs that we know are traditionally impactful to the databases and we know aren't going to get turned on to any extensive degree anyway. So it allows those organizations to turn off any native audit they already have on, receive those resources back into their infrastructure, do something else with those resources. But more importantly now, have something better than just an audit. Now an organization can take this type of a technology and answer a lot of different questions with it and really solve a lot of problems with it. What the organization can do is it can discover where that data actually exists. I have PCI, Sarbanes-Oxley, or financial, changes to financial data. Where is my financial data? I have HIPAA that I have to meet. Where is my PII and HIPAA-related information that exists for that type of an environment? I've got to go find that. And most organizations have an idea of where that is or where it should be, but most organizations don't know what they don't know. And this allows them to go out and find all the places where you have databases that you might not know existed. And within those databases and the ones you know that did exist, what types of data is resident or present in those databases? And is any of that data under scrutiny for regulation? Secondly, the ability to go out and assess those databases. Do they meet the security standards set by your organization? If you're a public organization that needs to meet DISA standards for security for your database servers themselves and the database configuration, assess it, make sure it does meet DISA standards. If you want to meet CIS standards, if you just want to have a policy that identifies the HIPAA basics for how a database should be configured, these are all things that can be done here. Obviously, setting controls, as my example was earlier, having a security enforcement in place, and then, of course, having audit and security around whatever type of information it is. If you want to audit everything, I don't advise it because you got to put that somewhere, but you can. It doesn't impact the database as native audit would, but now you can be very selective in terms of what you want to audit, but you can choose to audit beyond just the regulation. The regulation is what you need, but you can move toward what you should do and do that without the impact on the database. And lastly, of course, it wouldn't be a solution if it didn't have some level of monitoring, measuring, and reporting. And of course, and we're going to see a little bit of this here. I'm going to go into the product here for just a bit and show you just some examples of this that tie directly to some of the regulations around PCI, Sarbanes-Oxley, specifically MAS as well. I know it's not necessarily relevant here, but MAS is the Monetary Authority of Singapore, but it just happened to be part of my presentation, and of course HIPAA. So if we look at discovering sensitive data and analyzing risks, of course, I'm going to just build that out. If we look at PCI, Sarbanes-Oxley, certainly there are relevant aspects of both of those there. HIPAA, we spell it out here a little bit more detailed, discovering electronic protected health information, identify and locate all individually identifiable health information. It's pretty explicit. You have to know where it is. So if we look at how this happens, from a secure sphere, our product being secure sphere, from our product perspective, when we look at the type of information here, number one, I need to find where the databases are, right? Most organizations have a good idea of where their databases are, but it is interesting to me that I would say 90% of the time I find a database that no one knew was out there. Now, oftentimes that database doesn't have anything critical in it, but it is nice to know that it exists. But this is step one. Let's go find all the databases and where they live. And so we go and find them. And then what you can see down here is, of course, the list of them, what the operating system is, what the type of database it happens to be, again, the type of database that they're running here. And then I can choose to accept or reject whether I want to actually start auditing that database. I don't need to be on the database to audit. I can be in the network. I optionally can be in the database if you wanted me to be with a very lightweight agent, which takes about 5 to 10% of the amount of CPU that native audit would take, so significantly less than native audit, but it allows me to do it on the database if that was a preference. But of course, we can capture that data in the network as well.
Hey Terry, this is Brian. I did have a question come up on that last slide.
Sure.
They were asking about legacy environments, AS400s, mainframes, anything, because it looks like a lot of that is current database, but I guess there's some question about whether it supports legacy environments as well.
Yeah, good question, and the answer is absolutely yes. Just as a side note, we actually are the only database vendor that actually makes their own agent. I talked about agents a moment ago. Certainly, we can capture that traffic on the network. That's no problem because your AS400 and your mainframe database data is going to be DB2 anyway, so you can see DB2 up there. But in the event that we were tracking privileged operations that are happening at the database level, we actually make and write our own agent. Even the database vendors themselves that write mainframe and write and build the databases for the mainframe, they don't even write their own agent. So we're the only product out there that is fully self-contained and fully self-written for those types of environments. And you don't see big data and Hadoop and some of those things up here, and that's really just to be fair, just the age of this screenshot, but we happen to support certainly all your big data, Clouderas, Mongos, and Teradatas, and Netezas, and if you use it, typically we're going to support it, absolutely. So let's move to the next section here. We've identified databases exist, where they are. Now we need to identify what data exists within those databases. So we have a number of predefined data types that we will look for and find within the databases, and you can see them over here, whether it be pharmaceutical, well, both of these are pharmaceutical, standard address numbers, et cetera, and other sorts of things. Or we have items over here that are very specific to healthcare, right? Insurance group number, insurance member number, patient record number, social security number, et cetera, that we've created here as well. And in these cases, we do a search and we scan the database. Now, to be fair, when we scan a database, it's not like scanning a network where I just find an IP address, I find a port that's open, I validate that that port happens to be running a database service. That's simple to do, and I don't need anybody's help to do it. When we scan a database, it requires that we go into the database. It requires anybody to go into the database and find where this data exists within that database. It's a common question that comes up, well, how do you do that? Well, for us to do that, we scan it from one of our network appliances or network devices. They can be virtual or physical, that's fine. But when we scan that, we do need a database username. And the depth of which that database username can dig is the depth to which we can gather data and understand what's there. So typically customers either already have an account that we can use, or customers create a very explicit account strictly for our systems within those databases so we can connect to them, and they lock that account down to a very specific IP address, our IP address, and make it an extremely secure account. So it's not an issue for customers, but just I like to note that it does require a user for us to go to. And yes, we will scan the databases for default users, and we'll let you know if the default users are there as well. That would kind of be part of the vulnerability assessment aspect of what we're doing here. And of course, what we can see here is, yes, in this particular database, we found payment card information, and we do test that against the Loon formula. Where numbers can be tested against formulas, we will. And of course, the insurance group number here. We look in the column names, the table names, as well as the actual data portion where we can analyze via regular expression to find this data. So I've built this out. I mentioned vulnerabilities. So yes, we found the databases. Yes, we found the classified data. Now it's time to find vulnerabilities. Why? We have databases. I would argue that probably everybody on this particular call has databases that are not patched to the current date patch. It's nobody's fault. That's just the life and the world we live in, right? A lot of times applications don't allow for the patching of a database for a while. A lot of times the databases that you use and store your data in are actually run by a third-party organization. Maybe it's your EMR, your EHR solution, and they will patch the database for you when they get around to it, right? So you're running with systems that may or may not have the appropriate patch levels on them. In these scenarios, we scan those databases and look for what vulnerabilities exist based on the patch level and based on the configuration that you have in those databases. And if we look at this, it looks a little bit like this. So we've taken one here from a HIPAA perspective. This is one that we've created a HIPAA password policy test that matches both a business unit or a corporate policy, if you will, from the healthcare organization to understand what types of basic configurations need to be set for their HIPAA compliance, what their regulators have said in terms of how they need to manage passwords in the database. This is just a basic example here, but it could be PCI DSS configurations, the standards organizations that have their own benchmarks that are out there. All of those exist already within the system. And the result that we wind up getting is we get a small list like this. Well, it can be small, it can be long as well, to be fair. In this case, it happens to be small, and we see vulnerability assessment results. And I see that I have, some of these failed in terms of the system just simply wasn't configured to do what we asked it to do. Some of them passed, they were set appropriately, and then others had an actual error on there where maybe there weren't any clear text passwords that existed there. What we do is we highlight the failed one. We have locked and expired logins, and then I get a recommended fix. We don't have it highlighted here, but we suggest a recommended fix. You can go in there and fix the locked and expired logins that would be there. The point is we help organizations understand how the configuration exists throughout their infrastructure so they can then take action and do remediation on that. Now, that's all about just discovering where your databases are, discovering where your data is, and discovering what vulnerabilities exist there. And to be fair, that's really just step one, discover where your critical assets are and what their current state really is, the risk of those current assets. And we'll give you a risk score, quite frankly. We're going to tell you if you have a database that has HIPAA-related information in it and PCI-related information in it, and it has high severity vulnerabilities in it, that is going to be a high-risk asset. And we're going to list all your assets based on their risk level, based on what is there and what their current vulnerability status happens to be, so that you can take action on all of that. But that really is, as I said, just step one. Step one gets you to the ability where now you're prepared to say, I know where my data is, now let's start prioritizing what we're going to audit. And we start talking about how do we do the audit. Now, audit has two factors to it. Audit has who has touched my data, meaning who has gone into my database and touched the data historically, and I want to print a report on that. That's what governance tends to ask for. But we need to start with who actually can touch my data, who can go into my database and actually can touch that data. Because HIPAA actually does say, based on your interpretation, HIPAA actually does say, and not here explicitly, if you have users who have access to your data and they haven't used that access in half a year, you need to turn those users off or at least remove their access until they need to use that data again. Now, sadly, there isn't a database out there that tells you the last time a user actually used a particular operation that they have, or a particular role, or touched a particular table. So it requires solutions like ours to be able to map two different things together. It requires us to understand how users access your data and what rights they have on that data. So this is the excessive permissions table for us. It's where we can go in and get a summary graph of your database. Here we have just one database. The last used period, so the users, their last use date over the last year themselves, so we can see how often that database is actually used. The objects classified by data type that people are actually using in the database, payment card and stuff, insurance addresses, and email addresses, etc. The most important piece here is really which business department is accessing my data. And I can drill into each one of these, and that's what we'll do. I'm going to drill into G&A here because they really shouldn't have access to really any private data. And if I drill down into them, I'm going to see that the G&A group have access to payment cards. Now, obviously, we make this a worst-case scenario. Payment card information, address, passwords, etc., all the way down the list of things they probably shouldn't have access to. And then, of course, I can drill down further into that. And I'm not going to do that because of time, but the point here is giving organizations the ability to not only understand what people can do or have done on the data, but give people the ability to understand what can they do on the data. Should my G&A group have access to payment cards? No? Well, let's turn it off. Let's get rid of that access. More importantly, when we start to look at it, let's figure out how they got that access. Now, obviously, there's a lot of data inside here, and we do a lot of things with the data, and I don't really have it highlighted here, but you can see over here, even if you had database audit turned on a database, it doesn't distinguish between data that is sensitive or data that's unidentified or data that's unclassified or not sensitive. But because we've classified your data, I can create very simple policies and just simply say, who has access to sensitive data? And it prints up or will display that for me. Who has access to non-sensitive data? Print a report of all the people who've touched sensitive data. So we start to use the things we've learned to enrich what you get within the reporting framework. But more importantly here, I've got a guy named E. Wilson. I don't know his first name, but E. Wilson. He's in the G&A group. He has object privileges on an object called, whatever, numbers 37350, whatever. It sounds like a SAP table to me, but it seems to be a temp table, and it is marked as sensitive, and it has payment card information in it. That's why it's important. I want to know, how did he get these privileges? And I want somebody to review these privileges for me. So here are his privileges. He got privileges by receiving guest privileges, which he shouldn't have anyway, but guest privileges. He has a server admin role, which I don't know why anybody in GA would need to have that role. He is a DB user, principal key DB user, and he's that because that's part of the guest role. So it's time to start cleaning up the guest role so that these guest role users don't have the server admin user. Now, of course, my cases here are worst case scenarios. But the point is, this gives organizations the ability to come through here and actively manage these. You can see I can approve this, I can reject it, I can see what are the new privileges, and I can actually change these privileges right here within the system, or go into my Active Directory server and change them myself if I wanted to. The key here is being able to see not only those users who have access on my data, what type of data it is, to be able to see how they got that access and start giving people actionable information to go and clean up the user rights within the system. And all of that can be done in about 15 minutes to get the data, and then the work starts from there to clean it up. The big piece around this, though, is being able to combine what we do from a database user rights perspective, meaning the rights that users actually have that we've been looking at here, and combine that with the audit logs of what we actually see users do. Now, this one part's a little bit basic here. I don't dig into it at all. But here I can see that the departments. Some of these account names are actually tied to a department. Here's our E. Wilson here, and he's in G&A. I can see other what seem to be system accounts maybe, but they're not tied to a department. And I see other users here. The key, and this is the value here, a big part of the value here of the user rights management piece, is that I can tell you the last time this account was used to touch your data. Because what I'm combining is my audit of what people have done in the database and my rights review of what users have the ability to do in the database. Now, this is at a high level, but I could dig into, and I don't have the ability here on the PowerPoint, but if I were on my system, I could dig into E. Wilson, and I could tell you that He did a select on data last week, but he's never done a change in the database. He's never done a create table. He's never done a create user. He's never done any of these other types of administrative roles, though he may have the right to. So from a HIPAA perspective, it's time to turn those roles off, especially if they haven't been used in 6 months. And in most organizations, when you start to look at this for the first period of time, you're going to find that there are roles and rights that users have granted that they've never used, especially your applications, who were given rights that were massively excessive because they were developing the application, but those rights were never removed. And it's a key piece here of really starting to secure down the data infrastructure around data. So if we look at the second to the last section here, audit, monitor, and secure user activity. So here we're talking about audit controls. A covered entity must implement hardware, software, and/or procedural mechanisms to record and examine access and other activity in information systems that contain or use electronic PHI. So I use the example here of MOZ, but this could just as easily be HIPAA. It doesn't really matter what the regulation is. The requirement is you need to audit access to my data. I don't care what the data is, if it's HIPAA data, if it's financial data, if it's PCI data. I need to know who's doing what, when, and where. This allows us to do this, as I said, without your native audit tools turned on, give you the exact user, the source, destination IP. Here you only see about 6 columns here, 5, 6 columns. But we have about 33 to 40 columns that we could add here. And as you can see, I can retrieve all roles, restrict roles, and I can select the columns that would be on here. Now, this is what we call our index data, but I can see the exact query that was done here, the exact operation that was done. And if I added more rows, I could tell you, or more columns, I could tell you the type of operation. Was it on sensitive objects? You can actually possibly see down here, let's see if I have it here. It's not here on this page. We ask our organizations, our customers, what do you need to see most frequently from a data audit? And these are the types of things you see on the left side, just quick views. Show me the database users that are going here. Show me my applications that are going in. Show me the source IP addresses. And down below, you can't see it down here very well, but I can see, show me everybody who failed to log in. And down below, you'd also see, show me access to sensitive data. Because again, well, here we go, sensitive query overview. Tell me anybody who touched sensitive data. Being really to get to the nuts and bolts of what an organization needs to know to not only meet regulation, but also to be able to have policies around how people touch and use their data. And this is typically where organizations have zero visibility and the ability to do this. Same sort of thing, just PHI. They just show it in a different way, but as I said, it doesn't really matter here. Here we've taken the object. We see its patients and contacts. We know this. Why? Because we classified it, and we classified these as patient and contacts. So I know the users who touched patient data, the user that touched contact data, and of course, if it were PCI or otherwise, it would be there as well. And the key piece here is answering a simple question. What was the response size? How much data was actually taken? Here, 1,400 records, 8,000 records, 13,000 records. Doesn't mean it was stolen. It just means whether or not we can actually see it. And there's a question that comes up sometimes is, could I tell you what the records were that they actually saw? I can tell you the answer is yes, but you have to be selective about that, because obviously I can execute one very simple query and I could pull 40 million records. You have to make sure you have the amount of space to store all of that data, because if we have to show it to you, it means we have to store it somewhere. But yes, we can do it, and organizations do that sometimes selectively on ultra-critical tables. They want to know not just what was done, but also what was seen, and certainly that can be done as well. And of course, I'm going to speed up here, but financial data is exactly the same thing. It's just simply on different types of data here. So let's look at measure and report. HIPAA, being able to generate the reports that are necessary from a HIPAA perspective. Well, we have all kinds of reporting within our system. I think we have about 1,600 default reports, so more reports than any one person would ever need or one organization would need. They're broken down by compliance, regulation, application, SAP, PeopleSoft, e-business, etc. Here we've got a number of reports that are pre-built for HIPAA. Failed PHI access attempts, failed connection attempts, daily PHI access summary to PHI. So all the things that organizations would need. And the real key here is let's go back to the type of databases that an organization has. Imagine a scenario where an auditor comes in and asks these exact questions, because they do. Who accessed your PHI? Well, if you don't have a solution like this, you go to potentially one DBA group, the Oracle group, for example, and if they have the native audit turned on to cover this, they can give you a report. Not as detailed a report, but a report. If you have two groups, Oracle and MS SQL, then you need to go to two groups, and those two groups are going to give you two different reports. And if you have mainframe and AS400, as the question was asked, or the other types of databases, then you have multiple different other groups to go to as well. Hope that they have the appropriate auditing turned on, and hope that the reports that they can generate out of those solutions meet what your auditor's asking for. In this scenario, it's one report. Who touched my PHI? I don't care what data it was in. We audit it equally across all of that data, add all the additional context into it, doesn't matter what type of database it is, and give you one single report, who touched my data, exactly what's being asked for from an audit perspective. And quite frankly, exactly what is necessary from a security policy perspective to be able to prevent or restrict access to that type of data when necessary. The reports are simple reports, but it gives you things like A. Harris touched contacts and patients. I just take the top part of this here, but who touched patient data, who touched contact data. And of course, I can see exactly all the people were. Now, we chose only to put 5 columns in here, but I could turn this landscape and put all different kinds of columns in here. Here, we're limited to obviously the size of a piece of paper, or multiple pieces of paper, but still, you have to be selective on what you want to have in your report. But your auditors are going to be very explicit about that, and even your internal risk is going to be explicit about it. Same thing on the security side from a financial perspective. For those of you who have to meet Sarbanes-Oxley, here it's Moz, but it's pretty similar to Sarbanes-Oxley. So being able to see who created logins, who created users, what are the operations that were actually done, and being able to demonstrate that you know and can demonstrate that you've seen people doing all of the controls. So I go back to this as just really a final wrap-up. When we talk about the difference between native audit and no audit and database activity monitoring or database audit and protection, the difference is audit is just audit. And when you're turning on native audit, it just gives you that one piece. And just being able to turn on native audit isn't enough to do any level of data security by any means. And quite frankly, it's not even enough to do basic audit, because even the native audit tools, they don't go and find any data for you. So they assume you know where all your data is. And I can tell you, at least from my experience, most people don't actually know where all of their data actually is. So they can't even get you all the way there anyway. When we talk about what it takes to really be able to do data security, it takes a number of different controls set in place to be able to add context to that data so you can have the right level of reporting. But that's not really enough to actually have security. When we start to talk about security, what does it take for security? Well, security really requires the ability to have actionable evidence on top of that audit. So I audit all of this activity happening, but now I need to have controls in place if I want to have security. But does anyone actually know everything that could happen to a database? In a security department, if I ask them, what are the 5 rules you want to put in place to protect your data, they'll give me 5 rules. And if I ask 5 more customers for 5 more rules, I'll get 25 more rules, all very different. And if I added them all together, that would be a great set of rules. But no one organization really knows everything that they need. We've worked with thousands of organizations over the years, and so what we've done is we've built an analytic tool for security that takes all of this data that you've collected from our database product, and even from products we haven't talked about, our file product, and what we call our Cloud Access Security Broker product that protects things in Office 365 and Salesforce and Dropbox and Box, all these sorts of things. It brings all of this data in and allows us now to really be able to identify anomalous behavior outside of any policies you might create, comparing one DBA to another DBA, comparing one application to another application, and really being able to see what's happening in that data and letting organizations know when things like this, a compromised user comes in and says, I see some data happening. There's a direct query of data, historically only accessed by an app, but I see somebody internally accessing this data that they shouldn't be accessing. They've never accessed before. The user is a non-technical user. This is one of those G&A users I talked about. And generally, this user doesn't directly query the database either. So our result is this is likely a compromised user and a theft of data. There's about 5 other things that happen between all of that. That's not really enough information, quite frankly, but the scenario is simple enough that the idea is really being able to identify the potential risk. And of course, we can quarantine the user or do other things. But as I said, there's a lot more detail and a lot more context that happens there. In another scenario, it might be a malicious user. Now, malicious users are not as common as compromised users, but in this scenario, and this is a true scenario, by the way, I have a user, and I have a database, and this data is only supposed to be accessed by law enforcement. Yet I see direct access from a different network That is not the law enforcement network that's been authorized. This is the compromise of a private customer or private customer information. This is a malicious user, likely, but it may also be a compromised user, and we have other details to be able to separate between the two as well as part of this particular solution. Final assessment in this particular real case scenario was this was an unauthorized access by an employee that we identified. And the key here is no policies have to be created. So from a security perspective, what this looks like is we dumped all of our audit data into what we call counter breach. And counter breach is this, call it secondary tool, if you will, that sits on top of our database activity monitoring solution. And it feeds information in, and this is a little bit hard to see here, but effectively what anomalies happening on these users. And what we build is we build a profile of everything that user does. We do this for every single user that touches your database, including your applications. And we distinguish between applications and users. We know who the user is from Active Directory. We know what they do in your endpoint, what type of endpoint activity is going on. We know, do they touch databases? Do they touch file shares? Do they go to the cloud and touch Office 365 and Dropbox and Box? And what data do they put out there? And we've classified that data. A lot of things we didn't talk about today, but we bring all of that data in so we know what this person normally does. We know what everybody who touches your data does, so that we can use our analytics and our machine learning to be able to understand what is an unusual behavior for these users. And it allows us to take action on that when it happens. So to summarize, and I believe this is my last slide here, to summarize, when we start to think about Imperva, if you take anything away from today, recognize that Imperva's business is data security. Yes, we have web application firewalls, and we are by far the only leader in the Magic Quadrant for web application firewalls. We can do them in many different places, in the cloud, in infrastructure and platform as a service for AWS and Azure, as well as on-premise. But we do database security, file security, and cloud security as well. Today we focused on data security, database security, but really everything for the most part we do in database security, we do for file security as well, for your file shares. And we do all of what we talked about today for the most part, again, for anything that you have zero control of that you use in the cloud. Let's say you use a cloud-based EMR system, but you don't know what data you put into it, you don't know what data is taken out of it, and you don't have an audit. When an auditor says, how are you using that and what type of data is out there, it's hard to get that data. We can provide all of that for you because we can act as a man in the middle between you and your EMR system if it's cloud-based. Now, I'm picking on EMR, but it could be SAP cloud-based. It could be anything cloud-based, and it allows us to sit between there. The goal for Imperva is to be able to follow your data wherever your data goes. If it's internal, great. If it goes to Amazon, fine. If it's in the cloud, great also. We have coverage for everything from a data perspective because of all the breaches we talked about at the beginning. People and organizations simply do not know about their data. They don't know who touches it, when they touch it, how they touch it, where it is, and all the other aspects about it. So we provide that capability wherever your data is. We can monitor access to it, and we can build controls around it so that people can do their jobs, but you can rest assured that you have security in place so that when something unusual happens, you know about it. So I just leave you with these questions. I'm not going to go through the questions. I just leave you with them. Leaves about 5 minutes for actual questions. But if these are questions that you feel like you don't have the answers to, I think it'd be worth maybe a conversation that we can talk to and speak to you about how you solve these types of problems, because these are things that, quite frankly, most regulations expect organizations to be able to answer. But depending on the auditor and depending on the organization, sometimes the tools you have might get you there with a lot of manual controls, but we could do it very, very easily with a ton of automation, which is what we provide. So that leaves me, that's it. I wrap it up. So I'll hand it back over to you guys. And if there are any questions, I'd love to take some. Otherwise we'll wrap it up.
Hey, Terry, there's a couple of questions that we did have come through, but they're specific to certain organizations, so we'll take those offline. But I do have one more here that is a little more general on the question. We talked about the counter breach piece and how it rolls up there's some log aggregation that goes up to be able to pull that off. The question was is if it's supposed to be a replacement for SEIM tools like Splunk and the such.
Definitely not. I mean, we even at Imperva internally, we use a lot of we use a SIM tool, but at the same time, we also use a number of different analytics tools as well to be able to look for unusual behavior inside, including our own solution here. The more information you have, well, I should say, a lot of people will say the more information you have, the better. And to a degree, that's probably true, but the reality is you've got to be able to do something with that data. From our perspective, I'll use Splunk as an example. So, from a Splunk or QRadar or whatever it happens to be, they're only as good as the data you give them. And if all you give them are people that log in and people that log out and the user attack chain and all this, that's great. But the reality is the fact that somebody logs into a new device doesn't necessarily mean that something unusual happened. When we start to look at things that I really want to do something about, I want to know what the user actually did, meaning, yes, they might have logged in unusually into my database, but did they do anything they don't normally do? Did they do it with a different laptop they don't normally use? Did they touch a table they don't normally access? The reality is we created this product to be able to provide actionable data that people can take to our own product if they want to, and create security policies to be able to mitigate that in the future, mitigate it now. But at the same time, be able to take that same data and send it over to Splunk, send it to QRadar, or whatever type of solution you happen to use, send that data over to those devices, and increase the amount of accuracy they're going to have, assuming you have the right policies created there, to be able to give them more actionable evidence. So the short answer is we definitely are not a replacement for them. Our customers, they're not a requirement to be able to use our solution and be able to get value out of our solution. But a lot of our customers use SIM solutions to be able to capture this type of data and feed that into their SOC and other parts of the organization.
All right. Thank you, Terry. And this is Bryan Boam again. Wanted to thank Terry for his time. Did a great job. I want to echo some of the comments that he made. We spent a lot of time on the database access and controls, and specifically central conversations on the database. But to Terry's point, Imperva looks at data wherever it lies. A lot of companies that we deal with out there are trying to solve individual problems, individual cloud-based problems, individual database problems, individual DDoS protection problems. Imperva is the only company we deal with that covers it all. It does not care where your data lies. It wants to keep an eye on it and keep it secured. We'll follow up with each of the individual people on the webinar and follow up with the questions that were specific to each of the clients. We thank you again for your time, and Terry, thank you for your time.
Thanks, Brian.